A man breaks his leg 20,000 years ago. No ambulance, no morphine, no hospital for 1,000 miles in any direction because hospitals don't exist yet. By most modern logic, he's dead within the week. He isn't. Archaeologists have found skeletons over 500,000 years old with healed fractures, healed skull trauma, even amputated limbs where the person kept living for years afterward. No hospital did that. No doctor did that. Someone else did. And the reason why is something we've almost completely forgotten. Here's the question nobody asks. If ancient humans had no hospitals, no antibiotics, no surgery in the way we understand it, how did anyone survive an injury at all? A broken leg should have been a death sentence. An infected cut should have killed within days. And yet the fossil record is full of people who lived through exactly that. So what did they actually know? Let's start with one skeleton, because it changes the entire picture of what we assume ancient life looked like. In Shanidar Cave in northern Iraq, archaeologists found the remains of a Neanderthal man who lived roughly 45,000 years ago. His skeleton tells a brutal story. A crushed eye socket, a withered right arm, likely amputated below the elbow. Signs of a leg injury that would have left him with a severe limp, hearing loss from bone growths in both ears. On his own, in the wild, a person with these injuries doesn't hunt, doesn't gather, doesn't survive more than a few days. But the healing in his bones shows he lived for years, possibly decades, after these injuries occurred. Someone fed him. Someone protected him. Someone cared for a person who could give almost nothing back in terms of physical labor. Researchers now refer to this as some of the earliest hard evidence of compassionate care in the human story, proof that survival was never purely about individual strength. It was about whether the group decided you were worth keeping alive. Now let's talk about the bones directly, because they don't lie. In 2018, archaeologists studying a skeleton found in Borneo made a discovery that shouldn't have been possible. The skeleton, dated to roughly 31,000 years ago, was missing a lower leg. Not lost in an accident. Removed. Deliberately. Clean cut marks show the limb was amputated and the bone had healed and remodeled afterward. That means this person survived the surgery, survived the blood loss, survived the infection risk, and lived for years as an amputee being cared for by their group. That's not luck. That's medical knowledge, applied successfully, tens of thousands of years before germ theory existed. Then there's trepanation, which sounds almost too strange to be real. Across sites in Europe, Africa, and South America, archaeologists have found ancient skulls with deliberate holes cut into them, sometimes multiple holes in the same skull. This wasn't random violence. The edges of these holes show smooth, rounded healing, which means the patient survived the procedure and lived long enough afterward for the bone to regrow around the opening. Some skulls show evidence of 2 or 3 separate trepanations performed at different points in that person's life. Someone was drilling into human skulls with stone tools, and their patients kept coming back. Nobody fully agrees on why they did it. Some researchers think it was used to relieve pressure from head trauma or seizures. Others think it had a ritual or spiritual purpose. But whatever the reasoning, the survival rates recorded in the bones are the real story. In some Peruvian sites dated to hundreds of years ago, healed trepanation rates run as high as 80%. Compare that to Civil War-era battlefield surgery in the 1860s, where skull surgery survival rates were closer to 50%. In some ways, ancient surgeons were getting better results with stone tools than doctors were getting nearly 2,000 years later with metal ones. Pain wasn't ignored either. Ancient humans clearly understood that survival sometimes meant enduring agony, and they found ways to dull it. Evidence of psychoactive and pain-relieving plants shows up across ancient sites worldwide. Certain barks contain compounds chemically similar to what we now synthesize into modern painkillers. Poppy use for sedation dates back thousands of years, with residue found in ancient containers across multiple regions. None of these people understood receptors or nerve pathways. They understood something simpler and just as powerful. This plant makes the pain bearable. This one puts you to sleep. This one calms the shaking. That knowledge meant the difference between a patient who could hold still long enough for a bone to be set and one who couldn't. Wound care worked differently than you'd expect, too. Ancient humans didn't understand bacteria. They didn't know what infection actually was on a microscopic level, but they knew through generations of trial and error what worked and what didn't. Archaeological and ethnobotanical evidence shows that specific plants were used again and again across completely unrelated cultures. Honey, which is naturally antibacterial, shows up in wound treatment records going back thousands of years. Certain tree resins with natural antiseptic properties were used to seal wounds and stop infection from spreading. Yarrow, a plant still nicknamed soldier's woundwort, was used to stop bleeding and clean cuts across multiple ancient cultures who never had contact with each other. They didn't know why it worked, they just knew that it did, and that was enough to keep passing the knowledge down. Setting bones was its own skill, refined, and taught the same way flint knapping or hunting was taught. Splints made from wood, bark, and animal hide have been found alongside healed fractures that set correctly, meaning someone understood how to align a broken bone, immobilize it, and manage the healing process over weeks. This wasn't guesswork. This was accumulated knowledge, tested on real people, corrected over generations, and passed down the same way every other survival skill was passed down, through observation, through practice, and through people who specialized in it. Because here's the part that's easy to miss. There were specialists. Every hunter-gatherer group likely had someone who was, functionally, the doctor. Not a title, not a certification, just the person in the group who was best at treating wounds, setting bones, and knowing which plants helped and which ones made things worse. And that knowledge lived almost entirely in one place, the memory of the oldest members of the group. Before writing existed, an elder who had survived 50 or 60 years wasn't just a relative to look after, they were a walking archive, which plant to avoid during pregnancy, what a wound looks like right before it turns fatal, which berries look edible but aren't. Losing an elder didn't just mean losing a person, it meant losing a library that could never be rebuilt the same way twice. That's likely part of why elderly members were protected and fed even when they could no longer hunt or gather. Their value wasn't physical anymore, it was informational, and it was irreplaceable. Now picture how this actually worked day to day. Someone gets hurt during a hunt, a fall, a fight, an accident with a tool. They're brought back to camp, not to a building, but to the group itself, because the group was the hospital. Someone cleans the wound with what's available, someone else prepares a plant paste or resin known to help. If a bone is broken, it gets splinted with wood and bark, then bound tight. The injured person doesn't go home alone to recover in isolation. They stay near the fire, surrounded by people, fed by people who share food without being asked, checked on constantly because in a group of 20 to 50 people, a wounded member affects everyone. There's no such thing as a solo recovery. Recovery was a group project, whether you asked for it or not. And this is where the psychology becomes just as important as the medicine. Modern hospitals treat bodies. Ancient recovery treated people. Isolation wasn't part of the healing process because isolation, for most of human history, meant vulnerability. And vulnerability meant death. Being surrounded by people while injured wasn't a nice bonus. It was part of the treatment. Constant social contact, constant reassurance, constant physical presence. We now know that chronic stress slows healing and weakens immune response. Ancient humans didn't know the biology behind that, but they built a recovery system that accidentally optimized for it anyway because isolation simply wasn't an option they had. Compare that to how modern people recover from illness or injury. Alone, in a quiet apartment, scrolling a phone, waiting for a follow-up appointment in 3 weeks. Technically, we have infinitely more medical tools than any ancient human ever had. But we've stripped out almost everything else that used to come with healing. The company, the constant presence of other people, the sense that your recovery matters to the group around you because your survival is tied to theirs. That's the trade-off nobody talks about. We traded a support system that surrounded every injury with people, food, and attention for a system that hands you a prescription and sends you home to heal by yourself. Ancient medicine wasn't more advanced than ours. It was never going to outperform antibiotics or surgery in a sterile operating room. But it wasn't as primitive as we assume either. It was built by people who paid extremely close attention, who tested everything through necessity, and who understood something we've quietly forgotten. That healing was never just physical. It was never something you were supposed to do alone. A man breaks his leg 20,000 years ago. No ambulance, no morphine, no hospital, but he isn't alone. And that, more than any plant or splint or skull surgery, might be the actual reason he lives.